Welcome back to the Hit Like a Girl podcast. My name's Joy Rios, and we are here at Health 2025, and we are talking with some friends of the podcast, and Dr. Jamie Fernandez and Dr. Gigi Magan, thank you. You both are representing Alma first, and I really just want to start by saying mentorship changes everything. Can we talk about that? And the journey that you guys have on mentoring a set of students and the journey that they have been on, and where are you taking them?
Of course.
And why? And also, it's so lovely to see you.
Always lovely to see you, Joy, as well.
Thank you for inviting us.
Yeah.
Well, mentorship is super, super important. And as physicians, so Jamie and I were both family physicians, and the latest data is that Latino doctors are only 2.3% all in the United States. And not only it's a tough journey, but we also need to encourage the next generation to learn more about digital health. And that's one of the reasons that Alma first was created and how it came about. So let me step back and kind of give you a little bit of the context.
Please.
So I was originally born and raised in Peru. I moved to the United States when I was 16 to Sonoma County. And I've been in Northern California. And I have a background in public health. When I got into residency, I trained at Crises, which is an integrative medical center. And when I was a resident, I realized that about 25% of my Spanish-speaking patients were not using their health. And I took it upon myself and I called a bunch of them trying to figure out why is it that you're not using them? And some of them mentioned that they either had heard about it or didn't have access to the code to be able to use the portal. I also trained at Harvard UCLA, and that's how I met Jamie. And we bonded over the fact that a lot of our Spanish-speaking patients don't have access to the portal to use it. And it's not that I don't want to use it, but they need additional help. Like they're using Facebook, they're using WhatsApp. That's how it came about. And Alma First has the mission to bring pre-health students into these spaces to learn about digital health because they're going to be the next generation of clinicians.
And they're going to be the ones essentially helping the patients get the access that they need to their healthcare. So it's a little twofold in the sense that you're supporting the actual upcoming clinicians, but also the communities of patients that they'll be working in. Did you all have people that you looked up to when you were going through your medical school journey? And is that anything that inspired you, or like is something that you realized more was needed in order to support the journey?
Oh, definitely. So my journey was similar to Gigi's. Born and raised in Los Angeles. First in my family to go into medicine, trained at Harvard UCLA family medicine. And my second year of residency, I had a mentor who introduced me to the Vibe conference and gave me a ticket. And that's the first time I learned about it. And I remember coming and just being so awestruck by medicine in the context of venture capital, in the context of startups, in the context of media and business. And it was all different lenses that I was not exposed to throughout my whole medical journey. But once you see it, you can't unsee it. And so I came to Vibe, and that's where we met the first time, which is really great. And really started building relationships with people outside of the clinical context, but who still worked in healthcare and had a very important part of influencing the type of healthcare we were going to practice in the future. Then when I got back from Vibe into my clinic, I had all these ideas, and I was speaking to my co-residents, and they're like, Jamie, where did you go? Like, what is this digital health thing? Like, what are you talking about, AI? Like, we're not using it here. And there was just a huge disconnect from everyday clinician practice versus having the conversations of building the next future in the healthcare. So once I started introducing my patients to digital health, and similar to Gigi, doing telemedicine within my clinic, there was a student who was shadowing me. And it was so funny at the end of the first time they shadowed me, because they saw me introduce the healthcare portal to my patient, do a trial video visit within the room, like use those valuable 15 minutes of time to do that. And the student said, Dr. Fernandez, shadowing you is so different. It was like, you spend a lot of time doing like digital navigation with your patient. And I was like, yeah, I guess I do. It's a different style, but I think it's worthwhile. It's paid dividends. And my student, who was like pre-health student, also Latina, Spanish speaking, said, okay, well, let me help you with the next patient. And obviously she's younger, very tech savvy, was able to do it for me. And it started this cycle of training pre-health students to be digital navigators, right, in the clinic with me. And then once they were finished with the day, they were like, well, how did you learn about this? And I would say, oh, I went to a conference. You should come with me. They're like, oh,
Well, especially right now, there's a conversation about navigating healthcare and how difficult it is. And so for folks that are Spanish speaking and already like facing challenges in other ways, that like that navigation component is so important. So the work that you're doing is really incredible. Yeah. I'm really curious to see how your perspective has changed since you first started coming.
Yeah.
Because I'm sure like 1 year participation and also like either what maybe sparked ideas at the beginning and also seeing how things have evolved in probably a really short period of time.
Yeah.
What has changed? So what have you seen?
So my first conference, I came by myself with a sponsor, and that was 3 years ago. Since then, I was a resident ever since then, we've had 30 Alma First students come to either health, vibe, with full sponsorship. We pay for that. We either sponsor the sponsor ticket and their hotels, sometimes their plane flight. And since then, 5 of our students have gone to med school, talking about their exposure to digital health in their interview and their application. One of them has actually started her own healthcare startup, who recently has contracts with major health plans in Los Angeles. And the majority of the students that we have are starting to work in digital health as well, either as advisors or mentors. So that's something that we never imagined would come out of bringing students and the vision of Alma First. So like one of your questions at the beginning was, where are students going to go after this? And one of our big pillars of Alma First is that we're a nonprofit, but our mission is to elevate their voices. Like we want each of them to be quote unquote influencers or have their own individual brand so that they can see healthcare and almost paint healthcare in their vision.
Right.
Yeah.
Well, it also seems like it would be important to shine a light on these folks so that others can be inspired to follow and know that is a path. I mean, it's so important to have visibility to say, hey, this is an option. And I think that for many Latino and Latino folks, like they just don't know that there are more paths available.
Yeah, and they can see themselves as representative. And they feel empowered that their voices matter, even in these spaces. Like when we first bring them in, they're a little bit shy and definitely overwhelmed, but we train them. We teach them like, okay, the basics about networking, and also we improve their LinkedIn, we take a professional picture for them. Even like at other conferences, we had to give them actually professional clothing because this is like sometimes their very first conference that they come to.
Sure, and might not have the wardrobe for that.
Yeah,
I totally get it. Yeah. So it's an ongoing thing. But okay, there's one. Can I share with you? This is sort of personal. But there's an Instagram account that I follow that's actually based out of LA, and they're called Foods and Medicines. I really love watching their journey, and I love how much they show up for the community and basically essentially shine a light on like, hey, this is what we're doing. These are the struggles that we're facing. We're taking our exams and essentially walk with us through this. And it sounds like you guys are doing that in a very similar but probably more formal way.
And I think that's where representation matters. Yeah. When you see yourself reflected or like someone that looks like you and counts like you is doing this, is going into medicine, it really inspires so many people.
And I think it makes the community really proud. Like it's really nice to see like others being elevating themselves and also elevating others. And I also think, will we talk about some of the outcomes from some of the patients or behaviors from some of the patients? So if they're focused on digital health navigation, how has the community, have they benefited from that? I'm sure the answer is yes, but I'd love details.
So we teach our students to do help patients navigate 3 aspects: when the healthcare portal, telemedicine, and then continuous glucose monitors.
Okay.
So there are studies that show that Latinos are less likely to be prescribed continuous glucose monitors, not because they won't benefit from it, but because clinicians or healthcare professionals don't think that they can do it. They just don't think they're tech savvy enough. So what we do is go to community health centers and host a digital health booth where we actually bring CGMs and put them on patients and show them like, look, you can do it. And we'll write a prescription almost like for them and say, bring this to your doctor and show them that you want to continue having this prescription that's covered by your insurance.
That's fantastic.
Yeah, it's really been beneficial, especially, diabetes is just so prevalent within the Latino community. So spreading that awareness and providing options.
That's great. So you said there's 30 now, and then how do you guys plan to grow? I'm sure, what's your vision?
So every time there's a new either Vibe or health conference, I make it a goal to bring at least 10 new students. This past year, health has been quite difficult, a different political climate. We couldn't get enough funding this year to bring 10. We brought 2. And what we're hoping to do is really show, kind of pivot our nonprofit value, right, into how can we, this idea of digital navigation, how can we actually get value from that and show value to the point where we can charge,
right,
first of all, right, for the skill, or either help our students get speaking engagements where they're compensated for the time and their expertise so that they can fund their own conference.
Oh, I love that. I love that. So what has been your impressions? What are the things that you've engaged with and conversations that you want to take home with you?
One of the things that I really enjoyed was seeing more clinicians this year. I think in comparison to last year, definitely seeing more physicians getting engaged and having conversations, and also see more people from community health centers. So Jamie and I, we work at FQHCs, or federally qualified health centers, or community clinics, and we do a lot of the work. We see a lot of patients, and we're frontline clinicians. And a lot of the time, some of the tech companies forget what it's like to be on the front lines, and like what it's like to have all the clicks and like do all the things, coordinate all the care that frontline physicians have to do. And that's been pretty refreshing this year. I think there's still a lot of work that needs to be done. And I do love seeing that more people are having these conversations.
What about you, Jamie?
One thing I'm taking away with me is I heard a speaker talk about AI doctors coming in the future. And it really brought like a shiver down my spine, because just the worry, I knew AI agents were a thing and things, but I hadn't actually heard the term like an AI doctor. And I asked him after the sessions, like, well, why do we have to call them a doctor? Can we also someone like part of our care team? Let's expand the care team, which really sparked a lot of conversation. And then one of the people in the audience came up and said, did you know that in India, they just launched an AI doctor called
Meet August.ai.
Yeah, Meet August.ai. And it went viral in India. Like a couple million people are on it, and it's through WhatsApp.
Oh, let's talk about that.
Yeah.
I mean, especially like WhatsApp is very popular for Latino communities. Yes. So how are they making it work?
So apparently it's a number on WhatsApp that you can text, and it'll respond with medical recommendations. And a lot of people, and he says a lot of people in India who don't have access to a doctor have been utilizing it. And it's been like going viral, speaks all the languages.
Oh, wow.
And we can access it here in LA. So that's part of the things like I'm going to make an account and try it out, see how that worked, because that's going to be very disruptive. And one thing I'm bringing back is as my patients start using AI for their common ailments, I'm going to start asking my patients like, oh, what do you think? Have you done research on this before? Like, let's have a conversation about how to use this safely and how we can actually team up to utilize this valuable information.
Well, so how do you feel about it being called a doctor? Because we also talk about like Dr. Google, right?
Yeah,
and like patients going to Dr. Google. It sounds like this would not be the same thing at all. But like, I don't know. I'm curious to hear how that goes, because I wonder if it's like, it's going to recommend either an action or go to see an actual clinician in person.
Exactly. I think just because I work so hard to become an MD, that term doctor, right? It's like, it's a very human term. A lot of what we do is very human. So I would love to keep that sanctity of it, right? But also, yes, the knowledge, right? Then AI knows a lot more, and studies have shown that it's sometimes a lot more accurate.
Yeah.
And it's obviously more accessible than a human can be. So I think there's a new term that we need to give.
Yeah, I like that. And I just love the idea that it would be able to reach people. I mean, this access conversation.
Oh my goodness.
Is
huge.
I mean, the ability, especially it's a difficult time in the world right now. So for people to be able to actually some people are not going to the doctor.
Exactly.
Are you guys seeing results of that or outcomes of that? And is that something you feel okay talking about?
Sure. In terms of like patients are not coming to see the doctor.
I mean, it's a really difficult climate right now, and specific to the Latin American and immigrant population. And if you're open to talking about it, I'd love to know, like, how can we still support those communities in this difficult time? Because I'm sure there's a lot of fear, and people are in hiding and not feeling safe to actually either go about their daily routine or ask questions about their health.
Thank you for asking that question. So in Los Angeles, we've had multiple ICE raids, and they've actually come to the hospital we trained at Harbor UCLA. Into the parking lot as people are going to their specialty clinics. And that is so scary.
Yeah.
At County, which we're trained at. People are waiting 3 months to see a specialist and taking time off of work, doing all that stuff to get in. And the fact that they could walk into a place that's supposed to be for them, paid by taxpayer money to provide care for them, and then being taken away from their family is just horrible.
Right.
Like we've been trained in my clinic, like if we ever have an ICE to come in, we need to bring everybody from the waiting room into the patient rooms.
Okay.
Because then we don't have to say that they're here or anything like that. And I've had a lot of patients who have not come to my clinic. My no-show rate has increased. What I'm doing with my patients that I do see in person is always offer them the digital aspect.
Right.
And I tell it's more important than ever. I'd say,
Absolutely.
this is not the only time that we're going to see each other. If in the future, for whatever reason, you can't make it in person, know that I am always available through telephone, through video visit, and let's try it out here so that you're equipped with it.
Yeah, I think that's the key component is helping them get that comfort level that you're still there to provide care. And if they don't feel safe coming into the brick and mortar place, that you can still support them.
Exactly.
Yeah, and that's what telemedicine, like Jamie was saying, is it can be really helpful and really important because then they can do it from the sanctity of their home, right? Without being afraid that someone is going to come and take them away from their families, right? But the problem is now that with a teleclinic, like there's going to be some of the rollbacks from extensions that happened during the COVID-19 pandemic.
And when does that officially get rolled back?
So that actually got rolled back September 30th.
Oh, so it's done.
However, there is an extension for federally qualified health centers until December 2026. So we still have one more year. But beyond that, the problem is that a lot of the rural communities, federally qualified health centers are not going to get compensated for that care, even though it increases access and helps our patients feel more safe. So what are we going to do?
Right.
So this is why we need to have these conversations.
Well, what are we going to do?
Right? I mean, we have AI doctors.
Yeah, okay.
And at the end of the day, like it's kind of like part of our mission that we have to help our patients. So we need to increase these conversations and bring more access to our patients.
Okay, so what are the best ways to support you? Because the work that you're doing is not just helpful for the communities, and it's just health for people. The mentorship is a fantastic path to make that happen, but it's really just like, how can we make families and communities healthier? And how can we support you in your work?
Oh, well, thank you, Joy. So you can go to our website, almafirst.com. We also have a LinkedIn page. Twice a year, we bring in 10 students into our cohort. And we're always looking for support in bringing students to conferences because this is really where the networking and everything happens. So we're definitely open for any support or collaboration.
Well, what about, so as far as like activities at conferences, it's one thing to attend, but what about integrating them into more of the actual like stuff that's going on? Is that on your guys' radar, or have you guys worked on some sort of, the Vive and Health folks are really great about this. So have you guys talked to them about some collaboration?
We have multiple times.
Yeah.
Come on, guy. And Gigi, what do you think?
In terms of including our students, I would love to see more of our students like being panel or like talking about experience, right? Or like having some sort of partnership, because when we started, we actually developed a curriculum about digital health equity where we were using the pillars from the Tequity, from the Health Foundation.
Right.
And so this is how we train our students, because 3 years ago, we don't have any specific guidelines. And how this came about was because we wanted to train more about ourselves. And so we're like, okay, let's put this together and then we'll train others. And that way everyone gets to learn more about this. So definitely want to continue expanding with the curriculum. And it would be wonderful to see if we can develop a partnership with other foundations or see if we can have grants. So TBD.
Yes, well, keep going. Well, I love how far you guys have come. I know that there's still plenty far to go. Yeah, there's no shortage of work to do. But thank you guys for your efforts and thank you for all that you do. It really matters.
Thank you, Joy. And one thing I just want to put in, the first health conference, we did a podcast.
Yeah.
With Betty, where I think we basically manifested everything. Yeah. And I listened to it recently and I was like, oh my goodness, we thought about this organization that we were going to build and bringing more students in here. So this being on this podcast is always a charm of good luck.
Well, okay, so let's manifest.
And she's in med school now.
Yeah, I know. I know that. I'm so proud. Okay, what are we manifesting? New partnership.
Yes, and sustainable partnership.
Yes.
Okay.
So we can scale and grow and have more students.
I love it. Okay. Well, let's check in at the next one.
Yep.
Yes.
Yeah, thank you, ladies.
Awesome. Thank you, Joy.
Thanks for listening. You can learn more about us or this guest by going to our website or visiting us on any of the socials with the handle HitLikeAGirlPod. Thanks again. See you soon. Again, thank you so much for listening to the Hit Like a Girl podcast. I am truly grateful for you, and I'm wondering if you could do me a quick favor. Would you be willing to follow or subscribe to this podcast, or maybe leave us a rating or review? Or if you're feeling extra generous, would you share this episode on your Instagram stories or with a friend? All those things help us podcasters out so much. I'm the show's host, Joy Rios, and I'll see you next time.